What is PMS, premenstrual syndrome? Premenstrual syndrome, PMS, is a combination of emotional, physical, psychological, and mood disturbances that occur before menstrual cycle, typically ending with the onset of menstrual flow. PMS occurs in the last half of a woman's menstrual cycle.
How common is PMS, premenstrual syndrome? About 90% of women experience premenstrual symptoms at some point in their lifetime. What causes PMS, premenstrual syndrome? The exact cause of PMS is unknown but is believed to be related to interactions between sex hormones and brain chemicals, neurotransmitters. What are the signs and symptoms of PMS, premenstrual syndrome? Great variety of symptoms have been attributed to PMS. Women can have PMS of varying duration and severity from cycle to cycle. The most frequent mood-related symptoms of PMS include anger and irritability, bloating, anxiety, tension, depression, crying, oversensitivity, exaggerated mood swings. The most frequent physical signs and symptoms of PMS include fatigue, weight gain, breast tenderness, acne, sleep disturbances with sleeping too much or too little, insomnia, appetite changes with overeating or food cravings. How long does PMS, premenstrual syndrome, last? The duration of PMS varies among women. Most women experience the symptoms for a few to several days in the week prior to the onset of their menstrual period. Some women may have symptoms for a shorter or longer time period, but symptoms of PMS typically start from the midpoint of the monthly menstrual cycle. How is PMS, premenstrual syndrome, diagnosed? PMS is more or less diagnosed based on history. The most helpful diagnostic tool is the menstrual diary, which documents physical and emotional symptoms over months. Keeping a menstrual diary not only helps the healthcare professional to make the diagnosis but also promotes a better understanding by the patient of her own body and moods. Once the diagnosis of PMS is made and understood, the patient can better cope with the symptoms. The diagnosis of PMS can be difficult because many medical and psychological conditions mimic PMS. There are no blood or laboratory tests to determine if a woman has PMS. When laboratory tests are performed, they are used to exclude other conditions similar to PMS. What conditions mimic PMS, premenstrual syndrome? Some examples of medical conditions that can mimic PMS include depression, cyclic water retention, idiopathic edema, chronic fatigue, hypothyroidism, irritable bowel syndrome, IBS. What treatments are available for PMS? General management includes a healthy lifestyle including exercise, emotional support during the premenstrual period, salt restriction just before the menstrual period, decreased caffeine intake prior to menstruation, stop smoking, limitation of alcohol intake, and reduction of refined sugar intake. All of the above have been recommended and may help symptoms in some women. Furthermore, some studies suggest that calcium and magnesium supplements may provide some benefit. What medications are used to treat PMS? A variety of medications are used to treat the different symptoms of PMS. Medications include diuretics, analgesics, oral contraceptives, antidepressants, evening primrose oil, vitamin E. Often, it is a combination of diet, medications, and exercise that is needed to afford the maximum improvement from the many symptoms of PMS.